Hi, Frida. Hi, Michael.
Hi there.
Good morning.
How's everybody doing today? Where are you calling me from, Michael? Let's see, that can't be a real backdrop.
No, I am near Annapolis, Maryland. So,
All right,
yep.
very good. And Dr. Frida, where are you from?
I'm actually sitting in Naples, Florida right now.
All right, nice and warm down there, I'm sure. Well, I appreciate you both talking to me today. We have so much to cover. We talked a lot about autoimmune disease on our pre-call, but I would like to get your 35 years in the industry, Dr. Frida Lewis Hall, and I would love to get your thoughts on just what impresses you these days in terms of innovation in the autoimmune space.
Well, I think there's a lot of interesting work in autoimmunity that is is in the backdrop of a few things. The first is our model of working in autoimmunity has changed a little bit. We're thinking about it in different ways. If you let me give you an example. So with COVID, who thinks about autoimmunity as it relates to an infectious disease? But it turns out that with COVID, we discovered in the midst of that crisis that it isn't actually the virus that killed you, but your own immune system's reactions to the virus that led to such devastating outcomes. And so thinking about the autoimmune system as a system that can be engaged and put to work, if you would, on behalf of your long-term health. So I'm really excited about work, just for example, in stimulating Treg cells to move into action, if you would, in cases where where inflammation is causing damage, and those Treg cells, then a part of your own body, are going to work to reduce the inflammation and to change the outcome of the disease. So I'm really excited about the kind of the different angles that we are now using to approach autoimmune disease. And the list of them is long and very devastating, and most have very high unmet needs. Lupus, sarcoidosis, vasculitis, arthritis, we could go on and on. Imagine if we're able to find a mechanism that is fit for purpose for any number of those, if not all of those.
And Michael, I remember last time we spoke, you talked a little bit about the innovator's burden. And you said it's not for the faint of heart. What did you mean by that?
Yeah. So, we love innovation in healthcare. There are patients waiting for companies, researchers, academic institutions to come up with treatments to solve these long-term issues. The problem is those companies are going to face a more difficult path as an innovator. I mean, the entire scientific method is, it doesn't work until you prove it works. And in a new space, in a new area, they're going to suffer, skepticism. There could be a regulatory pathway that's not as clear. There could be, physicians not so sure. They're going to wait and see. There could be, the FDA could take a harder line. There could be, complete response letters. There could be clinical holds. This is a difficult place to go when you're sort of, creating a new path. So I think and we tend to work with those companies all the time, and you just have to, overcome that. And I think, and just recognize it's going to happen. It's a lot easier to be the second and third drug in a class. The payer strategy is all figured out. The regulatory pathway is all figured out. Of course, you're not going to be first. So I think that's what they have to sort of do, that calculus.
If I can I tap in on that? Because I'm really excited about innovation in healthcare. I actually think the events of the last few years may help a little bit. With COVID and other kind of world events, I think we've been shaken. My husband always says, people don't change when they see the light, they change when they feel the heat. And I think that COVID really brought some heat to the equation of evolving our healthcare system. We were shaken by all of the gaps in our healthcare system. We were stunned by our lack of data and understanding of what the risk factors are of being affected by certain diseases and having differential outcomes that lead to, terrible inequities. We were inspired by doing some new research, if you would, and doing it with new partners and collaborations in a way that I'm not sure we had worked before to bring vaccines and treatments for COVID to the forefront. So I agree, it is a burden and an innovator's one. I'm hoping that our realization of the profound needs that we have and improving and innovating for better health are going to give us a little bit of lift and inspiration to do some things differently.
Yeah, and on that note, I wanted to bring up a story you told me about someone that you spoke with at the President's Frontier Conference, and I think this story sort of sums up just how important innovation is in our healthcare system. It was somebody who lost their husband to cancer, and they had to take their medical records from one doctor to another on a CD, which it's incredible. And you described it as we have Star Wars medicines, but in a Flintstone healthcare system. And I thought that was really interesting, and how it sums up the challenges that patients have.
Well, I'm glad you said it, because I got in trouble for saying Star Wars medicine in the Flintstones healthcare system.
Well, Jetsons would be more
a time or two. But sometimes you just have to tell the truth.
Yeah.
And I do think that there are some wonderful. One of the things I love about what's happening now is we're reimagining the power of data and analytics, where things we didn't include, like social determinants and access and the quality of access to outcomes. We weren't really thinking about that as specifically to focus on change as I think we are now. And so hopefully we'll soon have Star Wars medicine and the Star Wars healthcare system with the changes that I think are underfoot today. So I like paying close attention to companies, organizations, institutions, and individuals that are doing work to help turbocharge us with data, that are helping with their analytics to point us in directions that maybe we wouldn't otherwise have gone into, and to develop new business models and new scientific and research models based on this new data and new insight.
If I could add to that, Tony, I actually think Dr. Lewis Hall also mentions that COVID was sort of an inspiration in terms of innovation about what could be accomplished and save countless lives. COVID also, I think, shined a spotlight on some old problems. However, I mean, oximeters that didn't work on people with, darker skin, which wasn't even discovered during the middle of the COVID crisis. The impact of how poorly our patients with chronic disease and multiple chronic diseases, how many of those patients died. Those were the patients largely who died. We have to do better. We have to innovate more in our care models for patients with chronic illnesses. And then, of course, the big one, which I know everyone is very concerned about, but just the health equity issue, as well as making sure our trials are diverse. So I think COVID was an amazing sort of social experiment, but it also, I think, highlighted some of those problems we've had for a long time. And I think there's a lot of room for innovation in those parts, or else we're going to repeat over and over again.
And if I can, I would love to underscore the equity word, right? Because I think in many cases we were seeking equality in healthcare. And one of my favorite visuals, if you would, is, three children standing at a fence trying to see a game. The tall one could see over, and then there are two shorter ones who couldn't see at all. A new depiction has a child in a wheelchair. And then equality gives everyone a box of the same size to stand on. Well, guess what? The wheelchair couldn't get up on the box, and the two shorter children still couldn't see over the fence. And of course, the one that was already tall was just getting a better view. What we really need is to give people boxes of the size that they need to get over the barriers. And I think that you're absolutely right. COVID really shined a light on how simple they could be, like an oximeter that's giving the wrong read and may lead to the wrong treatment and therefore the wrong outcome, or different ways in which patients are perceived or treated within the healthcare system, or the access that they have. So we have a whole host of things to address if we want equity and justice in terms of the healthcare system that serves all.
So there's a large contingent of people in this country that like to treat healthcare as if it's like a chess piece to get points up on their opposing party. They don't like the word equity. What do you say to that? I mean, we have a government healthcare plan that people tried to repeal. They were unsuccessful. They tried to offer an alternative. They failed. They take issue with the term equity, like I said. I would love to get your thoughts on just how crucial that is to keep top of mind, Michael and Frida, in an election year. I'm going to start with Michael.
Yeah, as I've spent 30 some years in healthcare, and that is probably one of the most frustrating parts about all of this is we're politicizing. This sounds a bit naive, but we're politicizing something that just, there's no room for it. There's no business for it. It doesn't help anything. And the fact of the matter is people getting healthcare only helps the system. It cuts costs. It allows people to work. It does all of those things, right? So that's not really the conversation we're having. I think we're just in the last few years, it's just anything we can find as a wedge to divide people. That's what we're doing. So, I actually think when you look at industry and you look, and you work with our, brave men and women who work in hospitals or on the front lines, this is not a concern from them. They just want to help patients. Pharmaceutical companies, device companies, they want to solve problems. So I think this is largely an issue of people who have very large megaphones who want to divide us. So kind of a non-answer, Tony, but it's other than it's frustrating.
Frida?
Well, Michael, we couldn't agree more. We must be related.
This conversation is going to wallow in agreement.
It is. It will. So it is very frustrating. I agree with you on that. And we've been admiring the problem for a while, addressing it where we can. But there's data piles that just tell you that health is a pivot for almost everything we want to accomplish as individuals, as communities, and as a country. So without health, you actually have a lesser workforce, if you would, because you need health and longevity in order to have a well-heeled, well-developed workforce. There's much data that suggests that countries whose health is good, wealth is good, right? So the overall impact of the country from a financial standpoint is positive when, when the people who live in that country are healthy as well as live in the world. So I think that all roads lead to health as an important practice. A part of it is getting the message out and making sure that the data that backs this up is there, as well as the passion that backs it up. And then we just have to continue to make the changes we can when they're at hand.
And Tony, if I could just add, I think one area of health that gets politicized quite often is mental health. And I still believe it is, I think if you were asleep for the last 50 years or woke up, I think people would be shocked at how sort of the progress we thought we were making, it turns out we're not making at all. People still don't have access to care. Medicines, many companies sort of got out of the business of working on medicines for mental illness. We're seeing some movement now on psychedelics and sort of changing sort of the viewpoint from is this what people need? But mostly we still have a shortage of providers at a time when we're coming out of COVID. And I don't think this is a controversial thing to say that the vast majority of people I know could probably use a little help trying to understand what we've just been through. And yet that seems to be still a challenge. And lastly, we still have a system where, we passed the Parity Act years ago, and yet, still, you're still paying more, often don't have access to mental health services as you do physical health services. So there's a lot to clean up there, but I also believe there's a lot of opportunity there for companies to come in, again, innovate in a space that I'm going to guess, 60%, 70% of Americans alone could use. So again, I think we could probably shine that innovation light on that area and make some great progress.
Well, as a psychiatrist by background and training, you are definitely speaking my language. Yeah. And you're exactly right. 40 years ago, when I saw kind of an uptick in attention and activity and promise that we were going to evolve a healthcare system that includes mental health at parity, and also evolves the science so that there's a variety of help for people across the spectrum of need. And it's been disappointing to see that progress slow, but also encouraging. I go back to the COVID moment where the contribution of mental health services to improve outcomes for patients who were either dealing with family issues, economic issues, and other social issues as a result of the COVID pandemic, or individuals who were affected specifically during that time.
Especially young individuals too.
Exactly, whose lives were upended in a way that in my generation had not experienced. So I think our attention is turned again, and we have much in hand from a scientific standpoint. If we can apply ourselves, I think we have at least a road ahead. I don't think it's smooth, but I think there's a road.
Frida, let me ask you, what as a former psychiatrist, what do you think of the increase in services? Will tech fill this gap in terms of mental health care apps and providing access to young people through even the mobile phone to help mental health professionals?
If you had asked me this 20 years ago, I would have frowned. I would have given you a little bit of a frowny face because I thought of technology as depersonalizing, not personalizing. But I think with the progress in both the technology itself and the way in which we think about using it, imagine the gaps that can be filled for someone that's in a rural environment and can't get in to do a face-to-face. What about wearables that with the right data picture can help you predict what patients might be beginning to fail or become more ill. So I think technology can play a unique and very important role in closing the gap.
Well, that goes into my next question. Last time I spoke with Michael, talking about technology and innovation, we mentioned AI, and the exact word he used was yikes. So I would love to get a reminder of why AI warranted that type of response. I mean, we talked about Star Wars before, maybe a little 2001 Space Odyssey. Now.
Yeah, I think it speaks for itself, Tony. Yikes in that, wow, what amazing opportunity. And yet, like many things, when something's new, as we talked about, sort of the innovator's burden, are we ready for it? Are we ready for, is there a clear guidance from industry? Is there clear guidance from the FDA? Are physicians ready to be assisted by AI? will patients understand what we're saying? I mean, we're going to be, we have the potential here, maybe, of having early diagnosis. That's not something, generally speaking, that's not something we normally do, in a lot of disease states. So yikes in that, wow, what an opportunity, but there's a lot of work that has to get done to validate it, to make sure, that someone who claims to have a new AI algorithm, it has to work, because now we're relying heavily on it. So I think there's that. I also think the idea of AI in terms of health information is somewhat unproven at this point. People are going to start using, AI to talk about to ask questions about their health, to learn. Again, that's generally a great thing, except, is it accurate? Can we rely on that information? How is that validated? So I think nothing but opportunity, but there's still a lot of work to be done for the validity and the credibility.
Frida, final thoughts?
Someone asked me the other day, they couldn't remember what the A stood for and thought maybe it was actual intelligence, not artificial intelligence. But I agree with Michael again, that it's a double-edged sword, right? As most new technology and information is. So carefully ensuring that we're using it wisely and safely, and that we validated it as it will intentionally be able to support and help people. We want to be sure that it doesn't unintentionally harm. I'm especially excited about it, though, as it relates to developing new therapeutics, because one of my areas of passion is purposing or repurposing medicines that may be deprioritized or not continuing on in development. And many of them show great promise. We just have to figure out what promise. And I think that AI is going to help say, well, this drug over here for disease area A may actually have an effect over here. And instead of a decade of an individual investigator kind of thinking through that, we might be able to make some of those connections and then test and validate that more quickly, and thereby moving new treatments to patients faster. So I think there's certain areas that I'm like, yeah, let's go. And there are other areas like Michael that I'm saying, okay, maybe we should check this out a little bit.
Yeah. Well, thank you both for joining us today. This was a great conversation. I hope to have you back on the next HealthCare Summit. But in the meantime, continue doing great work, and I hope to follow up soon.
Looking forward to it.
Thank you, Tony.